Good morning, everyone. Today is Thursday, March 8th. Thank you so much for joining into our weekly healthcare reform webinars. I appreciate you taking some time out of your busy schedules to stay informed for your clients and be the consultants that we are now required to be. For those of you that are new to the format, my name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. My duties include overseeing the traditional group health markets, the self-funded markets, the employee benefits segment, as well as what is left of the individual health market in Pennsylvania. We also have, an exciting speaker with us today, Karen McDaniel, who is our one of the co-directors of the Medicare Offerings Department, and our Medicare Compliance Officer has some legislative updates that she'll be joining in and presenting today as well. So if you are new to the format, we encourage you to ask questions. That's how we all learn. And you can do that in one of two ways. You can raise your electronic hand icon to the right of your screen in the control panel, or you can type in your question at the end, in the question box, and I'll answer that at the end of the webinar. So just with a quick show of hands, if you can hear me okay and see my screen, I'd appreciate if you could give me a raised hand. Excellent. Okay, so let's get started with the agenda. We do have a lot to talk about. There's a lot going on in Washington. So with our President's administration, some interesting things are happening. The Problem Solvers Caucus offered some bipartisan healthcare action items. They spoke at the NAHU Capital Conference, which was last week in Washington, D.C., and some of the initiatives they shared are, certainly initiatives that are near and dear to all of our hearts and are certainly are on our wish list, but the caucus consists of 20 Democrats, 20 Republicans, and they spoke about, again, their legislative initiatives, and it includes employer mandate, moving that employer mandate for groups of 500 plus, not 50 plus. Imagine a world that we live in if that would change. That would be great. And full-time being 40 plus hours, not the required 30 at this point. So those are all really exciting things coming up and being worked on. So I think we can all agree that they would be welcome changes. Also, part of the budget deal that is on the floor is the cost share reduction funding, skinny plan development, aka short-term medical plans, hopefully something other than short-term medical, and expanding that 89-day limit. Older folks could be charged more in the 5-to-1 ratio versus the 3-to-1 ratio that we are held to at this point, expansion of HSAs, and also the Hyde Amendment, which would prohibit any abortion services from being paid for with government funds. Also previously mentioned, and this just in on the NAHU blast this morning, the Alexander Murray bill to reauthorize the cost share reduction payments and the Collins high risk pool funding that was back on the table. We mentioned that last week. That could be part of the spending bill. So again, that's all happening. Some of those changes, that's all within that spending bill. So we'll be watching that very closely. Another thing is medical records, electronic medical records. This has really been at the forefront and on the wish list even before the ACA was signed and bandied around. But it looks like the Trump administration it's been on details, but it looks like they're starting a new initiative called MyHealthEData. And of course, it's designed to empower patients by making sure they control their health data. Of course, there's a lot of portals now that you as patients can go on from your providers, the hospital systems, but they're not really shared between providers. And this could open it up and certainly help reduce duplicative testing and some of the other issues that come up with unshared medical records, over prescribing medications that don't work well with each other. So I'd say that's a positive step as well. D.C. Circuit Court of Appeals issued an order on Monday questioning the September 2017 deal that would shut down the lawsuit against the Obama administration over authority to pay the cost share reductions. That's a lot of talk. Back when President Obama was in office, the Republicans fought really hard to eliminate those cost share reductions because they weren't really adjudicated or approved for payment within the ACA law. So there was a court case filed, a lawsuit filed, and of course, with the cost share reductions now being removed, part of the Alexander Murray bill and possibly part of the spending bill, they wanted to remove that lawsuit. And now the Circuit Court of Appeals is asking, why would you want to eliminate the lawsuit? So, a lot of mumbo jumbo, but that's something we should watch as well to see where that goes. Apple to launch health clinics for its employees. That could be as early as this spring, acwellness.com. It is set to be, and when I look at this, I think of the Berkshire Hathaway, Amazon, and JP Morgan deal, but the AC Wellness describes itself as an independent medical practice dedicated to delivering compassionate, effective healthcare to Apple employee populations. It believes that having trusting, accessible relationships with patients enabled by technology promotes high-quality care and a unique patient experience. The centers offer a unique concierge-like healthcare experience for employees and their dependents. So we'll keep watching that as well. But again, an interesting study on the private sector finding a way to get around the law and come up with affordable options. Pennsylvania Human Services head, our former Pennsylvania Insurance Department Commissioner, Teresa Miller, spoke at a session on Tuesday, and there was a lot of talk about Medicaid workers being, Medicaid recipients having a work requirement, and of course, it's a left and right issue. Republican Brad Rose, Republican from Crawford County, cited research showing that the work requirement might affect only 7% of the state's Medicaid beneficiaries. But Teresa Miller countered that under that proposed legislation, the state would have to spend an estimated $600 million and add 300 staff members to implement the systems and supports required by the federal government to help people get and keep jobs if there was a state work requirement for Medicaid. So, again, under our state's administration, I don't think that's going to go anywhere. We're not going to get to a work requirement. And certainly with our budget issues going on at the state level, I don't think that anyone is going to be excited about that estimated $600 million in implementation or this bureaucracy. So that really brings us up to the under 65 group and individual legislative updates. And as mentioned, I'm going to hand it over to Karen because she has some exciting things, again, to share on what is going on the Medicare or in the Medicare world. So Karen, can you take it over?
I sure can. Thank you, Deb, so much. I appreciate you allowing me to steal some of your time. Good morning, everyone. So I just have a couple Medicare offering updates for you. We received some CMS proposed changes for 2019, and most of them are very, very exciting. We hope that they come to fruition. One that is definitely coming to fruition is the open enrollment period. It is back. If you have been selling Medicare for a number of years, you'll remember that the open enrollment period followed the annual enrollment period. It ran from January 1st until March 31st, and it was a one-time switch that allowed a client to make a change to the Medicare Advantage plan that they chose during the annual enrollment period. It's very, very helpful to the clients who regret their choice that they made, or perhaps an agent, it happens, they chose the wrong plan on the application, and it will prevent the client from having to call into Medicare to beg for a special election period for them to pick the proper plan for them that will give them the coverage they need. So we're very excited that this is coming back. We don't know all the details yet, but we do know it's going to run from January 1st of 2019 until March 31st of 2019. The second proposed change, dual eligible plan changes. As of right now, if you have a client who's dual eligible, and that is somebody who has Medicare and Medicaid, they can make a plan change for their Medicare Advantage or prescription drug plan every month if they wanted to. CMS is now proposing that they can only make a switch to another special needs plan once per calendar year. The third one is seamless conversions. A seamless conversion is when a carrier moves a client from an individual under 65 coverage directly to a Medicare Advantage plan if that carrier has those plans. They will now be, hopefully will be prohibited. Clients will have to opt in rather than opt out, with the dual eligible population being the sole exception. So they will still be automatically converted into a Medicare Advantage plan. The next one is greater opioid scrutiny. They will be more heavily scrutinized, greater review for those given prescriptions. For clients suffering real pain, the drugs won't be denied, but overprescribing will be prohibited. Reduce paperwork. They are trying to make the packets less, so there's not going to be as much information that's going to be included in the packet that you have to give to the client. More PDP plan choices. They want to encourage the carriers to create more than, currently right now the PDP carriers really only have 2 choices. They want to encourage more creativity in plan design, so they're going to hopefully allow them to offer 3 plan choices. And the last one is really exciting for a lot of people, is no scope. I mean, a lot of agents, they took away the 48-hour rule this past year, which has been helpful, but it's still kind of a pain sometimes to get that scope signed. So they're trying to hopefully get away from that and not have to have it at all. So as soon as we find out more information about these changes, like I said, these are just proposed changes. We will keep you informed, and maybe Deb will let me join in again as soon as we have more information. Next are new Medicare cards. The rollout of the new cards will be beginning next month, and they're going to have all current Medicare cards replaced by April of 2019. They're replacing the Social Security number with a Medicare beneficiary identifier, and there on the screen is a sample of what the new card will look like. So you'll just want to let your clients know that, they're going to be, the rollouts are not happening at the same time. So just because their neighbor or their spouse or friend received theirs, tell them not to panic. Theirs will be coming. It's not going to come at the same time. And CMS will never ask a beneficiary for their personal information. Your clients should be wary of anyone who contacts them about their new ID card. So they, and they want to make sure, you want to make your clients sure that Medicare has their current mailing address so that they do get this new card. And lastly, we have created a new compliance reporting page on our website. We have a compliance hotline that you can leave a message if you have a complaint about something, you have general questions, you can send us an email, or if there's any compliance questions that you'd want to send anonymously through the mail, you can send it to the address on the screen, mark it confidential and attention to compliance. If you have any questions for me, I can be reached at 800-926-8875, and my extension is 117, or you can send an email to that compliance email on the screen. That is it for me. So Deb, I'm going to make you the presenter again, or do you need to do that for me?
I think either of us can do it, but I will.
Oh, there I go. I got it.
Okay.
All right. Thank you.
Thanks, Karen, for joining in. I appreciate that. A lot of good things happening in the Medicare segment. I'm sure everyone that works in that segment is very excited about those updates. So thanks to Karen for jumping in and providing those for you. To continue on with our agenda, just some quick items. Highmark has, they launched MyChart earlier this year in different segments, but they are launching it in the Erie markets, and it is a patient portal for online scheduling, test results, special messaging, et cetera. You know, and again, that is just like the medical records and the medical e-data, MyHealthEData, just trying to get to a better place where there's sharing of information, and it would benefit, of course, consumers with pricing, paying for duplicative services, et cetera. So again, these are all things that are a positive in my opinion. Highmark also, Allegheny Health Network is unveiling a plan for a $25 million cancer center at St. Vincent. So for those of you in the Western markets, that should be pretty exciting. Here's some very exciting news. UnitedHealthcare announced, pardon me, that it will pass on drug rate rebates to customers. Now that's incredibly huge because for years the carriers with their formulary would get rebates, kickbacks, bonuses from the PBMs for, you know, for having them on the formularies, the medications, the you know, how much they're prescribed, et cetera. And it equals millions and millions of dollars. So UnitedHealthcare coming out and saying that they're going to pass on the rebates from the drug companies to the consumers is huge. They say that the benefit could range from a few dollars to $100 or to over $1,000 based on the prescription. But I think that's you know, a tremendous leap, and hopefully other carriers will follow suit. IRS has decreased the 2018 family contribution limit. The individual family contribution stays the same, $6,450 for the single. The family is now $6,850 versus the $6,900 that was announced, and that was revised downward due to an inflation adjustment provision in the Tax Cuts and Jobs Act. So that's a $50 reduction in the family HSA total contribution. And upcoming events of interest. You know, I do try to pass on the information either through my newsletter or on these calls. Pardon me. Goodness gracious, I so apologize. But, you know, events or training sessions that could be of interest to the people on my webinar. And Prime Pay Series, they have a webinar coming up at 1:30 on April 11th, and it's using compliance to get your foot in the door, and they have small and large group case studies. So I think that could be of interest definitely to those on the call that are in the group market. March 13th at 10 a.m., UPMC is going to have a webinar on digital health and how UPMC Health Plan turns a smartphone into a source of treatment and intervention. You know, again, following suit with all these e-data details. And then last but not least, May 17th from 3 to 5 at the Capitol Blue Retail Store in Enola, the Central Pennsylvania Association of Health Underwriters is presenting Cocktails with Class, and it is open to NAHU members for $10 and non-NAHU members for $20. It's from 3 to 5. It includes cocktails and appetizers, as well as a guest speaker from the American Heart Association. So for those of you that have not been to a PAHU, NAHU, or CPAHU event, this is a great way to meet folks, your contemporaries, and exchange ideas, you know, add folks to your resource list. It really is, again, an organization that is run by agents and created to support agents. So again, if you have any interest in that, let me know. There's information again in my newsletter, or if you can't find it or need additional information, just shoot me an email and I'm happy to send the information out to you. So that really brings us up to our open discussion for any questions. As you're forming your questions, just know that I will be back here next Thursday at 9:30 Eastern Time, and that is March 15th. Can't believe this month is flowing by so quickly. So let's see if we have any questions. Dave asks, to qualify for the HSA family limit, must at least 2 members of the family be enrolled in an HSA compatible plan? Yes, Dave. You know, the way the HSAs work, it's either single or anything else. So if it's a parent-child, parent-children, entire family, it defaults to the family deductible and family HSA contribution limits. So I hope that helps. And that is it for our questions today. We had very few questions. Maybe we overwhelmed you with, with everything going on. I certainly feel your pain. But if you do have questions after the webinar, please reach out to me. I'm happy to help in any way I can. And if I don't know the answer, I will absolutely find it for you through my resources. So again, I thank everyone for joining in. I thank Karen for joining in as well and offering those updates. And I wish all of you a happy and wonderful balance of the week and a great weekend. Thanks. Bye-bye.